Friends, my name is Jesse, and welcome back to Male Nurse Mentor. I continue to find it helpful to bring content surrounding what it is like to be a correctional nurse. The correctional system is quite a unique setting, a setting very different from a hospital, and one that many don't think about when it comes to being a nurse. Most people don't think about going to work in a prison or a jail, and I don't blame them. Like, why would you think about it? For those that don't know, I did work nearly a total of 6 years in the correctional system, both in the county jail and also in the prison here in the state of California. The reason why I did it is I went there to escape the hospital setting. Escape, but going to a prison, don't you escape the prison? It's true, I really didn't want to work the hospital setting as a new grad. I knew that setting wasn't going to be for me, it just wasn't a fit, and I had to figure out a different route. So that's when I went into corrections, and I found the correctional system to be my home, as weird as it may sound. The hospital setting just wasn't for me, it wasn't a good fit. As a new grad, I knew this kind of right away. Right when I graduated nursing school, passed my NCLEX, and it became a reality. I need to find a specialty that I want to work in. I don't want it to be med-surg, I don't want it to be the hospital in general. I had to find something else, and that's when I found the correctional system. Long story short, I found a way to pivot out of that. I now work from home, which is the craziest thing ever, because I would have never imagined I would have been able to do that. Maybe I'll do some more videos on working from home as a nurse, but for this series, I want to continue to add value to anybody who is thinking about corrections as a potential place for you to work as a nurse. And when you go to search, you're gonna Google, you're gonna find that there isn't a lot of information on it, especially a lot of good information. This video in particular today that I wanna bring to you guys are the positives of being a nurse in prison. Like, why should nurses go work in a prison? And I say prison only, this also goes with being a jail nurse. It's corrections. I've worked both settings for the most part. They're quite similar. The differences in terms of you working as a nurse aren't that much different. A lot of them are the same, unless you work intake in jail, but then intake and reception at the prison is probably similar to that. But let's talk about it. I have a list over here. I'm gonna be looking off to the side, so in case you see my eyes wandering, I got a list over here. All right, friends. So first thing from the list, I got the excitement. Some people want that energy working in a place that is dangerous, right? That's what I wanted. When I go back to thinking of my journey, it started with really wanting to be a police officer. Again, long story short, I didn't want to do that for the several reasons that you probably imagine. But I've always kept the interest, right, of being in law enforcement. When I went to go to apply for my first nursing job, I knew I didn't want to work in a hospital. I decided to connect the dots, right? Law enforcement, nurse, boom, became a jail nurse. I was working amongst the people holding the badge, but I wasn't holding the badge myself. And there was a lot of excitement in the county jail. Craziness happened there. If you haven't heard my very first day in county jail, I did make a video on it. Check it out if you're curious. But one of the benefits to this is if you're looking for excitement, jail nursing, prison nursing, correctional nursing as an umbrella is a perfect place for you. Some of us just want that excitement. We just want a job that is different every single day, and jail nursing will do that. Correctional nursing, a little bit less. Intake in county jail is the craziest thing you'll experience for good and bad reasons. But if you want that excitement, that's a good place to get it. It's either that or the ER. Jail nursing is a different type of excitement, and that's just the best way to describe it. It's just different every day, a little bit of chaos, quiet to chaos, 0 to 100 real quick. So the next thing I wrote here is there is an edgy or a cool factor to this, right? Every time I tell people, hey, I'm a prison nurse, I've been a prison nurse, I always get a reaction. And I can understand, right? When people think of prison, think of jail, it's like, right? For people, you think of people who've been there. You think of people getting arrested and going there. And you, as a nurse working there where those people are, there's a little bit of an edginess to that. And because of that, there's like a cool factor to it. I've always liked people's reactions every time I've told them, hey, I'm a jail nurse, hey, I'm a prison nurse, I've worked corrections. I always get this look, and people are always very curious, and they always want to hear about my experience. So if you're looking for a job that's considered edgy or cool, corrections is a place for you. Tying the excitement with that edginess, that cool factor, let's just get that out the way and be blunt about it. When I think of correctional nursing, that's what I think of. So those are some benefits in my eyes. The third thing that I wrote here is safety. You're much safer in prison than in a hospital, and this may seem like counterintuitive. You're going to the place where all the people that are dangerous are actually housed, right? How can it be safer? Well, you wear an alarm all the time, and everything is very much locked down. When I went to go work in jail, everything was super locked down. I wasn't even holding keys. Every single door was operated by an operator, and in the prison, I was holding keys. Everything was behind a gate. Everything was locked behind a lock, behind a lock, behind a lock, behind a lock. So many locks. And just for me to get to my car all the way to my place where I worked as a nurse in the clinic, it was like a mile walk behind a couple doors that were operated by an operator, and then also gates that required a key that I would hold throughout the day. And apart from these gates and needing a key for these locks and the doors with the operators, there's officers everywhere, and you also hold that alarm. It's an alarm that stays on your hip. Whenever you feel like you're in danger, you press it, right? And then all these officers are going to swarm to you. Whenever you're taking care of patients directly, for example, me in the clinic, just as an example, there'd be officers roaming the hallways. I just step out, hey, and they're always aware that you're working with an inmate, because these inmates at the time, right, in prison, when you're working with them there, and even in county jail, they're not in handcuffs. They're free to move around, but they are very respectful. As much as you need to be aware of your surroundings, and when you work with inmates, you have an alarm, every door is locked, you have officers. So I felt very safe. You also wear a whistle. That's a thing that the California prison system did, is you wear a whistle. Very sensitive thing. You never blow a whistle in a prison, because that's usually a bad sign. That usually means your alarm didn't work and now you're resorting to a whistle. So I've never, not once, not even one time, have heard a whistle while I worked in the prison system. Just in summary, I felt way safer working in that setting than any of my clinical rotations in a hospital, out in the community. You literally have like officers everywhere. It feels very, very safe. So that's a benefit for sure. And this one kind of ties into my next point. I wrote officers. Working with officers brings that safety. It's a very interesting dynamic you won't see anywhere else. For me, because I did want to do law enforcement, right? I wanted that excitement, like that feeling of being part of a group, right? I wasn't the one holding the badge, but I was around the people that did. So working with officers it filled that desire for me, right? It's a very unique dynamic. There's pros and cons. I could tell you about the cons in a different video, but as far as the pros, there's really great officers out there that really do get your back. And if you do find yourself in a sticky situation, right, where you feel unsafe, these officers are going to step in and really get you, right? They got your back. And, they've gotten my back on a couple of occasions, and, it's felt really nice, right? That's one of the reasons why I felt so safe. It's because I know these officers are around and I know they got my back. So just to kind of extend from the safety reason and the officer reasons, those are gold. Big benefit. I wish you would get that in a hospital. In a hospital, you probably have a security guard and you have yourself. So it doesn't exist in other settings, right? The next thing I wrote here is customer service is less of a priority. It sounds bad, I know, but it's one of the reasons why I decided to not work in a hospital, was that reason. I wasn't a fan of the hospital having this really large component of customer service. It sounds bad, but those juices, those blankets, especially to family members and other people, it gets tiring after a while. When I work as a nurse, I want to just work as a nurse. I don't want to do everything right, and because I didn't do this customer service part right, I forgot the juice, I didn't give the blanket, I didn't really attend to the family. Now their experience was pretty poor, right? Maybe I came in with a certain energy one day and I wasn't even feeling a certain way. It was just maybe the way I was presenting. I made someone feel off a little bit, and now that affects the overall experience of the patient. That was always a layer to the job that I didn't enjoy. So when I graduated, I was like, I don't want to work in that setting. I'm not a fan of it. Corrections, fortunately, has customer service, just the basic amount, right? Be respectful, be helpful, but you just have to be professional, right? That's it. Sometimes when you work in a hospital, you have to go above and beyond being just professional. You have to also lean into this customer service part of the job that, for me, I just can't explain it other than I'm not a fan. And if you're not a fan of that part, think of corrections, because in the correctional system, that part doesn't really exist. You do your job, you be professional. In corrections, that's really all you got to do. And that is the expectation. And it's really neat. It's really nice to just strip away all what I consider the BS, strip that all away, and then just focus on your job, focus on nursing, focus on outcomes. You don't really find that in a hospital. Another reason, right, another benefit is hearing inmates' stories. The amount of stories I've heard from inmates, the amount of life lessons. For me, friends, I like learning about life through my own mistakes, but also, hopefully, the idea is through other people's mistakes. Working in the jail, working in the prison, I've learned a lot about society. I learned a lot about life. I learned a lot about the people who hit rock bottom. I see how they move. I see how they speak. I see their ideations. I also have heard their stories, right, as to why they've gotten to where they're at. I've learned a lot about life, and that's a benefit that you get. Sure, you can get that working in other settings, but here you're literally speaking to the people that have messed up the worst that you can. But there's just something that you learn and that you pick up by speaking to these people. For me, was a real big benefit. Like, there's something that I learned about being present with these people. These people have nothing, right? But yet sometimes they're happier than I was coming in to work. I was the one who was cranky. I was the one who didn't want to be there. And these guys were literally unable to leave. And yet they were happier than me in prison when I can leave after 8 hours. So that taught me a lot about life. It taught me, and this is just one lesson I'll mention, it taught me that, the prison is in our own minds. That is where the prison exists. You can live out here in the free world and still be miserable, or you can be in prison and actually have outgrown the misery and actually accept the present moment and be happier there than out here. That's why whenever I've left the prison, now that I've left, I've really wanted to live a life that I want to live. And every time I would leave the prison, it would remind me to actually utilize my time and my freedom as much as I can, because these guys don't get that chance and they're still making the most of it. I have the chance and I'm not even making the most of mine. Just something to mention. Another benefit is that it's still nursing, just in a different setting, which is, if that's what you're looking for, perfect, right? It's a perfect fit, kind of like how it was for me. When I was working there and people would ask, why are you working here? I said, I just had this interest to work here. I didn't want to work in a hospital. I was looking for something different. This is just perfect. It was different, not a hospital. Fit a lot of the boxes for me in terms of interest. It was a perfect thing for me. Just know it's still nursing. There's still doctors. There's still care teams, physicians, physical therapists, LVNs, MAs, CNAs, registered dietitians, social workers, like mental health staff. There's still dental, pharmacy. It's still healthcare, just in a way different setting. It's a mini world in there. So don't get too discouraged thinking that it's very different. It's quite similar. When it comes to healthcare, it's just provided in a much different way because of the unique setting that it's in, if that makes sense. Let me reassure you about that. The next thing is, this one's a random one. You get a license plate blocker for your car, which is, kind of intense, but it is something you can get. When I went to work there, I found this out. I got it on my license plate. You park your car out, right? Sometimes the inmates can see your car from the yard. It's very far, but they could see it, right? And sometimes inmates are landscaping out there in the parking lots and things like that. So an incentive you can get, almost a security measure, is you can get your license plate blocked. You can get it blocked, which is cool. So if someone actually tries to look up your license plate, it won't show any of your information. It'll probably say, state of California worker or something like that. But it's a really cool feature that they do just to give you another sense of security. You can do that for as many cars as you want, I believe. So just keep that in mind. It's a really cool thing. It's like, when I knew my license plate was blocked, I just always felt kind of cool driving on the highway. A cop would pull up behind me, not pull me over, but I would be like, if he tries to run my license plate, it's gonna show I'm a state of California worker, CHP, right? Maybe he'll be more lenient with me. CHP works for the state government. I work for the state government. It never mattered, never got pulled over. It was just a random thought that I would have. So the next benefit I put here is actually working with inmates, because they're usually very thankful and they often need education. Like, you have to think about it. A lot of these people that are now older in prison, right? They lack a lot of education when it comes to healthcare. It would actually break my heart when I would see like grown men in their 30s, 40s, 50s who've been in there their whole life, right? they got arrested as a young adult, like 18 years old, maybe even before then, were in the system. They never really got educated when it came to blood pressure, diabetes, things like that, and just health screenings, basic things, right, like vital signs. They were always very thankful whenever I would actually assess them, provide them care, and also educate them, give them the basic rundown. Because a lot of these guys didn't grow up with solid parental figures. A lot of them didn't grow up with things that they need to know to be healthy. So oftentimes they would need a lot of education. They're really cool and really chill about it. A lot of them would ask questions, and they would really look at you like a resource. In that sense, it is a vulnerable patient population, right, that you're working with. It was always very satisfying to work with the inmate patient population. Crazy things happen, but for the most part, they were very thankful and they were really easy to work with and very, very appreciative of the care that I would do. So this next benefit, I wrote, so many places to work as a nurse within the prison itself. And it's true. When you are a prison nurse, right, in the California State Prison System, they have a mini ER, they have an infirmary, which is kind of like a SNF. They have an outpatient clinic. They also have specialty nursing positions like grievances and appeals, a resource RN, which is kind of like a discharge coordinator. They also have a case manager, and they also have infection control and public health. So there's so many different places to work as a nurse. You know, once you're in, you can pivot to different areas. For me, right before I left, I had pretty much worked in every single one of the areas, except just a few of them, like less than a handful. I got to see the whole healthcare system. And then I used that experience to get my next job, right, where I do work from home now. Just keep that in mind. Nursing in the prison, so many different areas to work. Nursing in a jail, there's really just intake downstairs and then sick call, which is upstairs. Those are the differences, but just know the experience is still valuable when you work in this setting. A lot of people think it's not, you know, whatever, you can have your own opinion. It did help me land a work from home job anyway, without hospital experience. So take that from my word of mouth. And now I'm down to the last two. These two are somewhat connected, but I'll do them one at a time. So this next benefit is often you get a pension. Prisons can be connected to the state government, which often means you are connected to a really solid benefit plan. And one of the benefits is a pension, right? In California State Prison system, in this system, you get a defined benefit pension plan, which means you get a pension and it's paid out for life until you die. It's all based on a formula, but just know pensions are very rare nowadays. Not many places provide them anymore because the employers don't see it as a benefit to give it to employees. However, the state government does still provide it. You know, CalPERS is one of the largest pension providers, for lack of a better term for it, out right now. And it's connected to the state of California. So in a way, you know, pick your poison however you want to look at it. I still trust it. If it's not there, that's fine. I invest outside of it. However, for the chance that it is there, you know, I'll continue to stay working for the state. A pension is very important, especially when it comes to retirement. A lot of stability can happen with that. The next thing that I added in addition to this is just overall pay and the benefits again. So if you retire from the state government, I think after 20 years, you actually get medical insurance and you pretty much get an early retirement. Because I started so young, the earliest age I can retire would be 50, 52, depends where in the state I work. And that would be with my pension, and that would be with medical insurance, the same that I have now, which a lot of people have to worry about. If you retire early, you think about insurance, but if you stay with the state long enough, you don't have to worry about it. And then the pay is pretty solid. You know, you may be able to make more working out in a hospital. However, when I left the prison system, I was making about $134K, working 5 8-hour shifts with no overtime. And there's so much overtime there, which may be a benefit I could just throw in here at the end. If you want overtime, there's a lot of overtime there. So just keep that in mind. As far as the list of benefits or reasons why you should be a nurse, that's really all I had. I know it was quite extensive. You know, hopefully some of those were helpful. Now I want to end the video with just a positive story of what it was like to work in a prison around inmates. So this story, I call it Birds and Crackers. So this was during the time of COVID, right? Everything's kind of locked down in a way. You know, inmates weren't able to come out very much. And for me, I was getting kind of redirected all over the place, right? This day, you know, I got there early. It was around 8:30 a.m. when a manager reached out and say, hey, I need you to go and do this COVID swab for me. So I had to go to a building. On my way to the building, what I remember is, not many inmates are out, but there was one inmate kind of walking from chow up back to his building. A lot of inmates leave their building, go to chow. It's like a walk you have to make. Chow is the cafeteria. You pick up your morning tray and then I think your afternoon lunch in a bag. And that's the first route to chow for the day. And I think in the evening they go back to chow to pick up dinner, just for context. I don't know why I mentioned all that, but maybe it was interesting. But this inmate was heading back from chow, back to his building. I was walking towards the buildings too. We're both kind of walking on the yards. He's, a couple yards ahead of me. I'm just kind of walking behind him, going to the building right where he's kind of walking to. And I see a bunch of birds. I see a lot of pigeons. And, the prison that I worked at had a lot of pigeons. That was one of the things that they always had. So many pigeons. I remember most of them were all the same color, and then you'd see one that was a random different color. Anyways, this inmate saw this group of pigeons, and this group of pigeons were going after this one pack of crackers. You saw one pigeon specifically try to pick up the package and drop it. And as I was getting closer, I was realizing the reason why. It was sealed, right? There's a packet of crackers sealed, and these birds were trying to pick it up and, trying to open it, and they couldn't. And they pick it up and drop it, pick it up and drop it, pick it up and drop it. And then this inmate saw that, right? I'm walking behind them. And he takes a moment to kind of stop, look at, the birds doing this. And he kind of walks over to where the birds are picking up this packet of crackers. It was like saltine or graham crackers or something like that. And then, he takes the time to go over there, picks up the package and crushes it with his hands. And then he opens it and he just flings it. And he just feeds the birds. And for some reason, that's just something I remember to this day, because, when people think of inmates, when people think of prisoners, when people think of convicts and felons in the prison, you don't think of that, right? You think of these cold-hearted criminals who, are locked up and you got to throw away the key. But, I saw something in that moment there that just stood out to me, which was this inmate caring for these birds and seeing that, hey, let me feed them. They're having a hard time. Let me open this pack of crackers and crush it for him and then feed him. And then he just went on his way. It brought a sense of humanness to the inmates there. Don't get me wrong, some of them can, be dangerous, but then you have an example of that where it's like you witness that and you're like, It makes you stop and think, right? It makes you stop and think that there's still a level of humanness to these people in there. And, it's just something that stood out to me. But anyways, friends, that's going to be it for this video. Might have been longer than what I imagined it to be, but I hope some of this was of value to you, especially if you're thinking about going into the prison setting to work or corrections in general. A lot of these go for both the prison and the jail. And as always, friends, if you're trying to find a way to reach me, Instagram is the best bet. Through DMs, reach out to me. Hopefully I can help you in some way. I'm further along this journey than maybe you are, or maybe you're trying to pivot, right, your career into a different path, right? Maybe corrections, maybe outside the hospital, maybe working from home. However it is that I can help you, reach out to me. I got you. But until next time, see you on the next video.